1 in 3 community-dwelling adults over the age of 65 years fall every year. At least 1/3 of those falls are injurious, and many are attributed to impaired control of the cardiovascular system, which may lead to autonomic dysfunction, orthostatic hypotension, or faints. In specialized consultant-led clinics, such as the Falls and Syncope unit at St. James's Hospital, these conditions are diagnosed and treated by analyzing transient changes of heart rate and blood pressure during standing. These clinics are a new and unique model of patient care. They are consequently extremely busy with significant waiting times and are best suited to managing the most complex patient cases.
So continuous beat-to-beat monitoring gives us a better and more refined understanding of the heart rate and blood pressure response to standing. It therefore helps us understand the etiology of falls and syncope in patients with diseases such as Parkinson's disease or diabetes, or those who are on cardiovascular medications. It can then guide us in the treatment and the prevention of these falls. It's also very useful in terms of education of patients so that they can understand their own physiology and then manage their symptoms better.
Current medical devices that allow the measurement of heart rate and blood pressure continuously are expensive and difficult to use and interpret, requiring significant training and expertise.
We use beat-to-beat phasic blood pressure to analyse a drop in blood pressure and recovery pattern, and heart rates can slow significantly and is often related to the medications that they're on, and they need to be pulled back or stopped completely. Now, if that service was available in the emergency department or in a GP service, these patients could be identified quickly and medication stopped, and it would reduce the incidence of fractures, hospital admissions, healthcare burden, all of the things. For the individual, is going to make a huge difference. But what we need is easy equipment that can be analysed quickly in order to identify this group of patients that it doesn't suit to be on significantly high blood pressure and heart rate medication.
Blood pressure is usually measured using the oscillometric approach. When the heart pumps, it causes tiny oscillatory changes in blood pressure that can be detected using an arm cuff. From such oscillations, a single momentary value of heart rate and blood pressure is reported. However, this method is not implemented in any continuous beat-to-beat measurement system at present. Hello, my name is Laura Perez and I'm currently doing my Master's in Bioengineering at Trinity College Dublin. My master's thesis is based at the Mercer's Institute for Successful Aging at St. James's Hospital Dublin, and the aim of my project is to use a novel modified oscillometric approach to measure dynamic changes of heart rate and blood pressure during standing. To achieve that goal, a system was designed and developed to continuously record the tiny oscillometric signals taking place in an arm cuff during standing. The system was designed to allow communication with other devices. The device was also designed to fit seamless with current clinical workflows and to be suitable for a clinical environment, fulfilling requirements of electrical safety and infection control. An ethically approved study was designed and is now underway to obtain data from 20 healthy participants and 20 patients attending the Falls and Syncope unit. All participants were asked to perform at least one standing test while the arm cuff was driven by a range of pressure waveforms. Continuous blood pressure and heart rate were recorded using the gold standard technologies, which allows us to determine the accuracy of the new system. Here is an example of a preprocessed signal recorded with our system. The beats are obvious most of the time, but we are still challenged by movement artifact when the person stands. We apply advanced signal processing algorithms to detect the tiny pulses varied with this noise, allowing us to extract them. We have shown that it is possible to extract heart rate successfully from the signal with a high accuracy as compared to the gold standard. Our results from this investigation suggest that our approach may be feasible and may lead to a potential new tool for a faster, cheaper and simpler monitoring of false risk factors suitable for GP clinics and other non-specialized centers. Having such tool would allow targeting a larger portion of the population affected by falls and faints that could be directly visited at GP clinics, consequently reducing the waiting times in specialized centers. Helping in the prevention of falls would have a huge impact in patients' quality of life and would entail a significant reduction of associated healthcare costs.